Hello and welcome to the webinar. My name is Julie Hashida and I will be acting as moderator for today's webinar, Integrating Employment Strategies into Supportive Housing Programs. Production of the National Healthcare for the Homeless Council with support from the Health Resources and Services Administration Office of Special Population Health. This session is being recorded. This is a 1-hour presentation with the last 10 minutes reserved for Q&A. Please type your questions or technical issues into the chat box at any time during the presentation. A selected number of questions will be answered at the end of the presentation during the Q&A session. The PowerPoint presentation and recording of this webinar will be posted on our website at www.nhchc.org within 72 hours. I will now turn the mic to your event host, Sabrina Edgington.
Thank you, Julie. Like Julie said, my name is Sabrina Edgington. I'm a Program and Policy Specialist here with the National Healthcare for the Homeless Council, and I also staff the Permanent Supportive Housing Working Group for the Council. I'm very pleased to introduce our two presenters today. We have Rachel Post, who's the Policy and Resource Advisor at Central City Concern. She brings 17 years of service, evidence-based practice implementation, training, and research to issues of poverty and homelessness. And among other roles at Central City Concern in Portland, Oregon, she developed strategies for integrating employment service programming into CCC Supportive Housing portfolio. Our other presenter today is Melissa Young, who's the Associate Director of the National Transitional Jobs Network at Heartland Alliance for Human Needs and Human Rights. Melissa's work includes managing the network's role as a lead coalition in advancing employment solutions for people who have the most difficult time getting and keeping a job. So during today's webinar, we plan to cover a few topics. First, we'll cover myths related to employment and homelessness. We'll also discuss opportunities to integrate employment efforts into your organization's philosophy of care. We'll talk about employment models and recommendations for practice, and you'll also be able to hear about how a supported employment program is integrated into the supportive housing efforts of Portland-based Central City Concern. So with this, I'll hand it over to our first presenter, Rachel Post.
Thank you so much, Sabrina. I'm really excited to be with you folks today talking about employment as an important component of ending homelessness. In addition to sort of the bio that Sabrina mentioned about me, I first started off working in community mental health about 17 years ago, working in a psychosocial rehab program using the transitional employment model that is often associated with the Clubhouse or Fountain House program. So in addition to working in policy, I have been on the front lines. I did my first employment support work at Boston Market, have a nice scar on my arm to show for that, and pushing carts at Target. So I bring that personal frontline experience as well. As you can see here in the slide, I have this quote, homelessness is a disease of losses, friends, family, health, housing, income, self-esteem, and hope. And employment can be really important and significant in regaining all of these. Last night I was sharing this slide with a friend of mine, and they asked what this picture was. And so it's a picture of what I see as a sort of hopeless, lonely soul walking in the tunnel of these dark woods. We're going to talk about the value of employment in a little bit, but first I want to talk about the myths or dispelling myths. So you may discover in your work in your community that people believe or have a belief that people who are experiencing homelessness aren't able to work. Well, that's not correct. Most people experiencing homelessness want to work. In Portland, we conducted a survey amongst our homeless community providers a couple of years ago and found that 65% of people experiencing homelessness say that they want to work. And they consistently rank paid employment alongside health care and housing as a primary need. Unfortunately, as all of you know, individuals experiencing homelessness face diverse and overlapping barriers to stable paid employment. And you know, the least of those is the personal barriers. So I learned a fancy word when I was first starting out in this field in Madison, Wisconsin, from one of my mentors about the iatrogenic effects of a mental health diagnosis. And iatrogenic is a fancy way of saying the secondary effects, basically what's imposed on somebody who has a label of a mental health condition. And so those secondary or iatrogenic effects are really related to systemic barriers and human capital and economic barriers to securing employment that a lot of people who are encountering our systems are faced with. Another myth I want to dispel is that, or what I want to say is actually true, is that linking individuals and families with stable earned income is a critical tool in the fight to prevent and end homelessness and can improve personal, financial, and family stability. We know that there are numerous studies that find that increased income is a strong predictor of individuals being able to exit homelessness. That's sort of one of those no-brainers that I'm sure all of you who are on the line today would understand. Income from work improves access to food, clothing, housing, and health care, increasing personal, family, and community well-being. And additionally, there's recently been a study conducted by a researcher in California of looking at people experiencing unemployment and to people who are employed in terms of health status. And there's now new research that indicates that people's health status improves just by being employed and having that structured activity in their lives as compared to not being employed. So this isn't related to having access to health care as much as it is just what the employment can do for one's self-esteem and mental well-being. So employment also shows promise in supporting recovery from mental illness and addictions, in reducing recidivism for people leaving prison, and in reducing reliance on public benefits. People experiencing homelessness have diverse needs and strengths. I really like to talk about this from, many of you may be familiar with the strengths-based model of case management that came out of the University of Kansas School of Social Work, Charlie Rapp, which really focuses on what people's strengths are. As you can imagine, as you well know, that there are people, being homeless is a really hard job. It takes a lot of energy, figuring out where you're going to find your meal, where you're going to put your head at night, how you're going to get your needs met. Evaluation research shows that individuals experiencing homelessness can manage or surmount obstacles, find a job, and maintain it when offered access to a menu of options for individualized employment, housing, and supportive services. So when we focus on people's strengths, when we provide the individualized services, when we provide a safe and supportive place to live, people can, in fact, work. I'm going to switch gears a little bit to talk about the kind of organizational culture that really needs to be present in order to successfully integrate your employment programming with your supportive housing. And this has certainly been the case for Central City Concern here in Portland, Oregon. I'll talk a little bit more later in the presentation about who we are, but it's so important. You have to look at the mission statement of your organization. Does it communicate that the end goal of self-sufficiency or recovery and is embedded in that a value around employment? You have to have an executive director, a board of directors, senior program directors, fundraising and public relations department managers, staff, all who believe that employment is critical to resolving homelessness and poverty. You also have to instill that value in your customers, your clients, your consumers, your recipients, whatever your terminology is for the people that you are working with who are experiencing or formerly experiencing homelessness. So it's got to be synthesized through communication from the very top to the front lines. There's got to be messaging about when people are coming into the program that is instilling in them or having a conversation about the belief that the end of this service trajectory that we're going to be working with you in partnership on is securing some sort of income, whether that's through benefits and entitlements or employment. And then also the funders in your community, or at the federal level, is there a value that they have in terms of helping people to permanently exit homelessness? As well as then the community of your partner providers. What are they communicating to the people that you're working with? So a way to operationalize these values, you're going to hear a little bit later in this presentation about the individual placement and support model. And if you go to this link, there's a fidelity scale that identifies basically it's sort of a recipe that measures the degree to which a program is implementing this particular model, and in it is values around employment within the organization. And you'll find a lot of there are about 25 items in this fidelity scale, and it's a Likert scale from 1 to 5 in terms of these areas of strength. You'll discover that you'll see some values around employment in your continuum of services. So with that, I'm going to pass over the presentation to Melissa Young.
Thank you so much, Rachel, and thanks all for being part of the conversation today. It's really a privilege to work alongside of Rachel and Sabrina and others across the country who are really thinking about and operationalizing what it means to provide employment support and resources and access to these supports to folks experiencing or at risk of or formerly experiencing homelessness. My name is Melissa Young. Like both Sabrina and Rachel mentioned, I have the privilege of helping to run with my colleagues the National Transitional Jobs Network, which is a coalition that's based out of Heartland Alliance for Human Needs and Human Rights in Chicago, Illinois. We are a national coalition that focuses on really helping to equip providers across the country with the best practices in providing employment resources and support to individuals who have several barriers to accessing or being successful in work. Our activities include technical assistance and field building throughout the country. We do that through providing resources and support and direct support to providers, cities and states across the country. We also provide state and federal advocacy support. Our goals are to increase the accessibility of employment resources and support in communities across the country, and we do that through providing and supporting direct public policy work. In 2011, the National Transitional Jobs Network got support from the Butler Family Foundation to launch an initiative that we called the Working to End Homelessness Initiative. The Working to End Homelessness Initiative was a bold vision that we had as a national network to really connect with providers across the country that were providing employment services to individuals who were at risk of or formerly experiencing or currently experiencing homelessness and had been providing these employment services to their populations. We brought together approximately 20 providers from across the country with the goal of highlighting the importance of employment in addressing homelessness and working with these providers to showcase what works in providing employment to these populations, identify best practices, and we hope to continue this project in terms of identifying systems and policy changes to service delivery and move forward with a bold policy agenda around these pieces of our work. I can tell you that we've got a series of briefs from this project that can be found on our website. They're listed on your screen there. There will be access to website links at the end of the presentation, but I really encourage you to take a look at the briefs that we developed as a result of this project. I'll be talking a little bit more throughout the conversation today about what we learned, but I think as a point of reference, one of the things that we realized that was critical to this project and to what we were learning was that program providers across the country felt isolated in providing employment resources to vulnerable individuals in their communities. And this project, this bringing together of community providers from across the country, really helped to build truly a community of practice among providers in which they could talk openly about what they had learned and what their challenges were. We also recognize through this project that we are just getting at the tip of the iceberg about the needs of folks in communities that are seeking access to employment and employment resources, as well as we're just taking the tip of the iceberg around what we're learning about best practices and the resources needed in communities and by providers. So we hope to continue this project well into the future to continue to bubble those things up to the surface. As Rachel very eloquently talked about in her portion of the presentation, we know that individuals experiencing or at risk of homelessness or those who have faced homelessness before face a number and a range of barriers to employment that make accessing employment opportunities challenging for them. And we know that barriers to employment very rarely exist in isolation. We know that barriers to employment exist oftentimes in a mass of challenges that are both personal and structural, and also are sort of put upon individuals by their community and by society at large. We also know that in order to help support a person being successful in employment, we need to really think about a comprehensive approach to service delivery that includes a range of thinking and perspective around how we fill gaps, how we provide access to employment opportunities that allow a person to learn while doing, and how do we help to build self-esteem and self-worth around employment. So I'm going to talk a little bit about employment program models that we identified through this project, through the Working to End Homelessness project, and a little bit about different structures to programs that we found as we talked to providers across the country. We divided the promising employment program structures that we learned about and we bubbled to the surface from our providers across the country into two basic categories: attachment to work approaches and advancement strategies. We know that individuals with barriers to employment oftentimes need and are looking to be successful in that first rung of getting a job and feeling successful in that job. But we also know that in order to help to move folks from a place of just getting that first job to truly being self-sufficient, we really need to think about advancement strategies and what do those look like. For many of the populations that we work with on a day-to-day basis, it may be a struggle just for them to get to work that day. But we also know that in order to truly help support them and to truly move beyond sort of that first job, we need to think about things like literacy and adult basic education at a point in time in which that person is ready to take those next steps. So we divided these promising employment program models into two basic categories. And I'll just say that we know as a national network that there are lots of other employment strategies that are out there that are combinations of these strategies, but also may be unique in and of themselves. And that is just part of the great approach of having a community of practice to continue to bubble up those new ideas. So under the attachment to work approaches, I'm going to talk about a few different models. I'm also going to try to talk a little bit about examples of those models in communities across the country. I will say that these, the models that I'm talking about and the examples are just one example of a whole range of approaches going on across the country, and I'm certainly happy to talk more at length with anyone if you'd like to get more information about any of these models that I talk about. So under the attachment to work approaches, one model that we've seen as a national network bubble up several times and in several different ways is a model called transitional jobs. One of the unique characteristics of transitional jobs programs is that it combines time-limited, wage-paying, subsidized employment opportunities in a real work environment, combined with skill development, critical supportive services, in an effort to help support an individual in accessing unsubsidized job placement. What I think is critical about this strategy, and one that I think is important for all of us to think about, is the opportunity to learn to work by working. That's really a tenet of the transitional jobs approach, as well as to provide critical stabilizing earned income. So that we've got an opportunity through the program model to provide a window of time where we stabilize folks through earned income, provide access to real work, and address barriers to work through working. I oftentimes say that all of us experience barriers to work on a daily basis, but what separates folks from being successful in work from other folks is oftentimes we have learned how to manage our barriers to work. The transitional jobs approach takes the perspective that we need to help support people in managing their barriers to employment while they're working. And it's really through the process of working that we understand where folks have challenges to employment, which I think is a unique piece of this strategy. One of the other unique pieces of this strategy is the layered approach of having skill development, both soft skill development and hard skill development, happening throughout the course of the program model. This strategy specifically has been subject to a number of rigorous evaluations in which it has shown to be particularly useful in helping to get people with significant barriers working, even in very, very tough economies, reducing recidivism after release from prison, and reducing reliance on public assistance. All things that we know are certainly valuable in our communities, but certainly I think one of the interesting and important pieces of the puzzle is the opportunity to really provide a learning, an earn and learn work environment. The DOE Fund, if folks have heard about this program model, is one example of a transitional jobs program model. And I won't go into too much detail about the program because you can certainly Google it. But this is a program model by which folks participate in transitional jobs through a work crew approach. The focus is on street cleaning crews in which folks can advance to sector work opportunities in energy efficiency, building maintenance, pest control, and commercial driving. So there's really a focus within this program on providing, again, that stabilizing work in a real work environment, and after a person is stabilized, really then moving towards what we would consider some advancement strategies through sector training and other job opportunities that are going to build skills for higher paying jobs in the future. Another project and one of the participants in our community of practice through our Working to End Homelessness initiative was the Homeless Garden Project in Santa Cruz, California. If folks haven't heard of this program, it's really a unique project and certainly takes on characteristics of several similar urban or rural farm projects across the country that is using sort of the what I would consider the healing nature of growing and gardening to provide a real work experience for individuals who are particularly vulnerable. This project operates a transitional jobs program in what we would consider a social enterprise or an earned income revenue stream by which the earned income from the garden is used to help support the payment of wages to participants. I think the other piece of this project that is particularly interesting is the real centeredness around, again, like I said, the healing nature of gardening, but also the perspective around life skills and occupational topics that focus on helping to support a person's self-esteem and growth, since we know those are key components in helping to support a person in their transition to employment. I'm not going to go into much detail at all about the second attachment to work approaches because Rachel will highlight that extensively in her conversation in a few minutes. But supportive employment on a most basic level is the standard evidence-based model for helping individuals with mental health issues transition to employment. Certainly Central City Concern, as you'll hear later, is really a pioneer in some of this work and integrating it within their supportive housing work that they do. The supported employment supports rapid entry to the competitive labor market, which is integrated and highly, highly integrated with support services as soon as the participant feels ready to work. And that's certainly a critical piece of the puzzle when we think about these attachment to work approaches. What comes to mind is the recognition that employment builds identity and dignity and the opportunity to work as soon as a person is ready starts the healing process and the building of self-esteem to address other challenges that the person may have. The next attachment to work approaches is an alternative staffing model. This has been a model that has been really pioneered by the Alternative Staffing Alliance, which is another national group across the country, and certainly we work with them on several different pieces of the puzzle. But one of the important things about the alternative staffing model is that this really acts as a brokering. It brokers temporary entry-level work placements for at-risk populations, and as a staffing model assumes the responsibility or any potential risk of what an at-risk or vulnerable individual may present for employers. This model is showing some promise in helping individuals learn workplace skills, build confidence, and leverage temporary placements to permanent jobs. Oftentimes, alternative staffing models really work to partner with employers that will take a person from sort of that temporary staffing entry-level job placement to a full-time job in a seamless way. Some other attachment to work approaches really work from that tenet as well, although it may differ depending upon the employment strategy. Goodwill Industries of Houston, they were also part of our community of practice, is one example of an alternative staffing project. They serve individuals experiencing homelessness, people living with AIDS, veterans, and people exiting prison. They serve over 3,000 people every year, and their employment services alongside their alternative staffing approach include life skills and job search training, and they work through their Goodwill stores to provide some of that on-the-job training opportunities. Certainly, if folks are listening in from communities across the country, Goodwill is oftentimes a great partner in thinking about where there may be employment opportunities for the participants that you serve through the donation centers and the stores within your community. And then finally, under the attachment to work approaches, very quickly, customized employment is an important approach that has oftentimes come out of or been informed by the disability community. customized employment helps participants begin self-employment or to negotiate restructured job positions that meet their strengths and the employer needs. So really taking into consideration the individual and unique strengths of participants and carving out specific jobs that fit folks' needs and strengths and challenges so that it's a win-win approach for both employers and individuals. This approach shows promise in helping at-risk populations, including, like I mentioned, folks with physical disabilities really carve out work that meets their needs in a setting that meets their needs. And certainly this has been important, particularly as we look at the disability community. And then I'll talk just very quickly about advancement strategy examples. As I mentioned previously, we certainly understand advancement strategies as being critical to help move folks from harm to hope and through along a pathway to opportunity and advancement. Contextualized basic adult basic education, adult education, bridge programs, and sector-based training are three advancement strategy approaches that I'll touch on briefly today. Project Hope is one example of an initiative in Boston that is working along a sector partnership perspective. The idea being that we recognize that certain sectors can provide for entry-level jobs for individuals and through training create career ladders into higher-paying jobs in the future. Project Hope serves over 1,000 participants per year, mainly low-income single mothers experiencing or at risk of homelessness. The project partners with local hospitals for healthcare-specific sector training and provides internships and placements in a variety of different areas within a hospital setting. What I think is really critical about their project is that they offer emergency shelter, housing search assistance, and a number of other supports in order to help support stabilizing folks and assessing or diverting crises. So they're kind of a holistic project that recognizes sort of that employment and sector-based training towards advancement really comes after we help supporting a person being stabilized in communities. And then finally, I'm going to talk a little bit about service delivery principles and techniques, things we learned and what bubbled up through the community of practice that we convened as a national network. And these service delivery principles and techniques, from our perspective, again, are not completely comprehensive. We know that there are other principles and techniques that other community providers and experts have identified that are critical in helping to transition someone to employment and provide that access. But we also think that this is probably a good start in thinking about and talking about what kinds of principles and techniques are critical in helping to support those transitions. So we identified 7 delivery principles and techniques. The first is that it's critical that we work with housing and supportive service providers to ensure that participants' immediate and long-term service needs are met through integrated service delivery. And I think Rachel was speaking about this previously and we'll have more to say later, but it's absolutely critical that we think about employment in the context of providing service needs that are integrated throughout our program or throughout our community or our community of providers. We know that, again, employment it cannot be successful if we don't think about the other legs of the stool that are important to stabilizing individuals. We need, as number 2, to be cognizant of the process of change in transitioning to employment. we talk about this a lot within our work, and it came up frequently within the community of practice that we convened, that we have to recognize the fears that are associated with transitioning to employment. And we as providers need to design and think about our employment approaches that we are constructing to really match the place where folks are at in understanding the value of employment to them and to the goals that they have for themselves. And that's certainly critically important, and we talk a lot about it within the briefs that we created out of this project. Number 3, we also feel that we can help facilitate the process of change through these supportive staff relationships. Oftentimes you see within the literature, and we have seen on the ground in providing support to providers in thinking about employment interventions, that peer support and providing supportive staff participant relationships and really thinking about that relationship is critical to facilitating the process of change, the process by which an individual recognizes and can see employment in themselves, but also as it fits in with their goals for the future. Number 4, and this goes back to what I mentioned just a second ago, it's critical for us to think about and leverage a range of employment and service options. I talked about a number of attachment approaches. I talked about a few advancement approaches. But really thinking about a range of employment service options is important so that we meet people where they're at and address their own interests at the point in time that they're at. We need to recognize the relationship between homelessness and trauma and provide trauma-informed care, and I am certainly aware that most of you are already very well aware of that, but certainly within the workforce community, this is an important thing to consider. We need to consider enhanced options to acquire work readiness skills, and that can be done through a variety of different ways, but we know that we need to help think about, and we need to be creative about ways that we can help acquire work readiness. And finally, we need to develop a toolkit of service strategies that are common to population-based barriers. We know that not every individual is going to need the full range of service delivery options, so we need to think about what are most important and how we can leverage those in our community. And then finally, we need to consider the best program model and job development strategy that fits the needs of the participants that we are supporting. So I'm going to talk just finally in the last couple of slides about potential partners and where do we go from here. In all of your communities, you yourselves, or you may have potential partners that may want to work with you and work together to really think about how employment fits within the work that you do. So for existing employment programs that may be operating in your community, you have a real opportunity to work with them and help them tailor their programs for your population. In your vendors, considering your vendors and exploring fee-for-service opportunities in which you can potentially provide a service and provide an opportunity for folks within your program to work and to learn real-world skills. There's also opportunities within your housing providers to talk about job training opportunities within the housing provider unit. We talk about and we think about oftentimes ways by which there can be job carve-outs within front desk, janitorial, and other pieces of the program model that can be identified and also provided to participants in your program to give them that work experience. And then finally, and Rachel talked about this quite a bit at the beginning, we really do need to have an integrated service team among housing and employment, health and supportive service providers, both within your own organization as well as your community. We know that that's critical to helping to support support entry into employment, but also going forward for the long haul. These slides will be available later, and this is the way in which you can contact me. I'm going to turn the mic back over to Rachel Post at Central City Concern.
Thank you so much. I really want to commend the National Transitional Job Network and also Heartland Alliance, who supports a lot of the work that they do with Melissa and Amy right now, for all the work that they've done in advancing our knowledge about employment opportunities and programming for working with people experiencing homelessness. I was really privileged to participate in that effort, and they have done a fantastic job. I also want to acknowledge that the first 3 slides I used were actually their slides, so thank you for that as well. I'm going to talk a little bit about Central City Concern and how we've implemented the supported employment model here. So first of all, you'll see a slide here with a photo of some of our employment specialists and an individual that we assisted in securing a job through the construction trade. And you can see, I mentioned earlier about the value communicated in an organization's mission statement. So you can see our mission statement is comprehensive solutions to ending homelessness and achieving self-sufficiency. Here at Central City Concern, who we are, we serve about 13,000 individuals experiencing homelessness and extreme poverty in a year. And this includes single adults, older adults, teens, parents, children throughout the Portland metro area. We were formed in 1979 as a 501c3 organization, and we provide housing, healthcare, and employment services. One thing we are extremely proud of, and which I attribute to a lot of the successes that we have here in working with individuals who are homeless, is that 46% of our workforce, we have 650 employees, are individuals who identify as being in recovery from typically addiction disorders, formerly homeless individuals, people who have criminal justice experience, and 25% of the individuals we employ are actually graduates of Central City Concern's programs. We have people at all levels of staffing here at the agency, from frontline, front desk, janitorial, all the way up to director level positions. We believe that every person we serve has unique skills and talents that can enrich the health, security, sustainability, and quality of life for us all. And I think that, again, a huge attribute to this organization is that we believe it so much that we don't think we could do the work without having staff who have direct hands-on experience in the community. Okay, here's a little picture that sort of also represents who we are and what we do. So you see in the middle of this a box that talks about homelessness and the various experiences that people who are homeless or formerly homeless may encounter. These conditions may have led to their homelessness, or they may be conditions that arise as a result of their homelessness, or there may be a combination. So we, as an organization, want to address this condition of homelessness through these 4 areas, through our supportive housing, which I'm going to talk about a little bit more in a moment, through integrated health care, which we provide through our federally qualified health care for homeless clinic called the Old Town Clinic here in Portland, the positive peer relationship. So as I've already discussed, we have a lot of individuals working for the organization who identify as peers and can share their own experience of personal transformation and recovery with the customers that we're serving. And then legitimate income for self-sufficiency. So we do that both through our employment programming, as well as we have a nationally recognized benefit acquisition and entitlement program that helps expedite SSI applications. To date, we have about 580 people we've assisted through an expedited process with an average length from application to award of about 90 days. we have an MOU with the Social Security Administration that allows us to help quickly process homeless applications. So now I'm going to talk a little bit more about the supportive housing, because that's what a lot of folks here are interested in hearing about, and how you integrate supported employment with supportive housing. So supportive housing, why supportive housing? Well, in order to meet the needs of the many conditions that people are experiencing resulting from homelessness, it's important to be able to provide support to people while they live in a community setting and work towards recovery. So we do this through providing quality buildings in which we're cultivating a community of supportive peers in an atmosphere of dignity and respect. And we also do this by having integrated collective team effort. So here at our organization, again, we use peers as paid professionals earning living wage salaries. We do our own property management. We use case managers, behavioral health and primary care providers, benefits and employment specialists. We have 21 residential buildings that we own or manage, consisting of 1,600 units of affordable housing. And as you'll see in this next bullet, 62% of these units are operated as what we call alcohol and drug-free communities. So these are communities where people are choosing recovery. They're people who are coming out of residential treatment or outpatient treatment who feel that in order for them to maintain their recovery, they would like to be in a clean and sober environment with a community of peers. And we serve individuals, families, veterans, and people coming out of the correction system. And then 64% of our housing is operated as permanent housing, including fair market affordable housing. I'm going to talk now about one of our programs that we began our supported housing, our supported employment model with, and this is a picture of our Richard Harris building. It's named after the founding executive director of Central City Concern. And this building, the very first two floors, you'll see the glass area down below is our Healthcare for Homeless clinic. And then the floors above that consist of 180 units of alcohol and drug-free community housing. So in this building, we have 80 units that are permanent and funded through Section 8 vouchers, and then the remaining 100 are operated as transitional, so that people are typically there for an average of 9 months to a year while they are becoming stabilized in their recovery, while they are looking for work through our employment program, and then moving on to a permanent housing unit. The reason why we don't use permanent housing subsidy is we find that often the individuals who are choosing recovery, who want to live in this environment, once they've stabilized, they can actually work and be able to pay their own way and find their own housing in the community with some help from their peer case managers. So in this building, we receive referrals from the City Hooper Subacute Detox Center and from 7 Portland inpatient treatment providers. This consists of community providers who represent a wide breadth of cultural diversity. We receive referrals from a Native American Rehabilitation Association agency, from community mental health program focusing on serving women, African American women in treatment with their children, etc. So again, this is housing for people choosing substance treatment, and our case ratio of a peer case manager is 1 to 30, and they work with the recipients on their recovery community supports, helping people connect to 12-step meetings, NA meetings, or alternative recovery support meetings, clean and sober activities, and they're also working very intensively with individuals on their permanent housing plans to the extent that they're going out and developing, these staff are developing relationships with landlords out in the community. And then they're working with these folks on identifying a source of earned income. And again, these are individuals with primary addiction disorders. Again, this is where we launched the Supported Employment Program back in 2007. So we have 152 total units of transitional housing that we launched for the supported employment. I'm going to talk more about what that model is in just a moment. But you can see in this 3-year period, we served 878 individuals in these units, and of those, 58%, or 457, exited clean and sober and to permanent housing. This is actually for the population that we're talking about. When you do a literature search, it's a very high rate of completion. I think the highest rate that we've found through our literature search of this subset of a population of people with primary addiction disorders experiencing homelessness is about 40%. And you can see that 276 of those individuals exited with employment. Now, our employment program follows people for 3 years. So while people may have exited without employment, our employment specialists continue to work for them for another approximately 2 years. So it's quite possible and quite likely that several more became employed. You can also see that 6% worked with our benefits and entitlements program. And then for those of you who are familiar with HUD-McKinney funds, we're responsible for tracking people for 12 months after they exit the housing, and we have an 80% rate of people remaining clean and sober and housed 12 months post-exit. So now I'm going to talk a little bit about our Employment Access Center. So this is a career center with a computer lab that's open to the public. Actually, we had to close down to the public at the beginning of July because it's not really a funded service. I'll talk more about funding later. But it reaches about, or has reached 3,000 individuals a year. But in that program, we provide this more specialized supported employment program where there's one-on-one employment assistance to nearly 1,000 people a year. And these consist of veterans programming, prisoner reentry programming, families and individuals experiencing addictions, as well as people with mental health conditions. So over 700 individuals in this last year were working as a result of the assistance they received from our continuum of care and earned an average of $10.25 an hour. So what is supported employment? The principles are competitive employment is the goal. So it's a job that anyone else in the community who isn't homeless, who doesn't have these conditions, could apply for in the community. And it's integrated within the community. Eligibility is based on the individual's choice of, yes, I do want to work. It doesn't matter what their history is, what their diagnosis is. People are saying they want to work. There's a rapid job search. There's no pre-vocational testing involved. We're really just helping people ideally within 30 days they've had their first interview with an employer. Integration of the mental health, addictions treatment, primary care, and employment specialists whose sole purpose is just to do employment development in the community with an individual. That is the extent of the value that we have for employment, that we have staff who are dedicated just for that purpose. And then we provide ongoing support to individuals for as long as they need it in maintaining their job and serve as a liaison. So we applied this model, as Melissa mentioned, historically IPS, or supported employment, has been applied to a population of people with mental health conditions. We've applied it to a population of people experiencing homelessness, with primary addiction disorders, and a large majority with felony convictions. You can see about 40% had co-occurring mental health disorders. And here is a graph that just illustrates that we placed people in about 53 different zip codes in these 15 placement sectors. So one component of IPS is that you're not supposed to place people all in one job with one company. And finally, potential funding sources. I'm going to leave this for you, and if people have questions, they can follow up with me by email or by phone. But these are the various funding streams that we have used. I'd hope to have more time to talk about each of these, but I'm afraid we've run out of time. And I'm going to turn this back over to Sabrina. Thank you.
Thank you, Rachel. If you have any questions, please type them in the Q&A section of the web room. We do have one question, and this is for Melissa. Melissa, in your customized employment slide, do these types of models also include people who have disabilities related to mental health?
That's a great question. I think I am not as familiar with customized employment being used with folks who have mental health disabilities, but I'm happy to sort of look to some of the research to get a question answered.
Great, thank you. And this next question could go to either Rachel or Melissa, but the question is around lack of dental care as a barrier, and also talking about the role of state vocational rehab agencies. Do you have any experience in addressing either dental health and then also working with state vocational rehab agencies?
This is Rachel, and I'd be happy to take that question. We absolutely have needed to work with folks around dental care in order to be to work on their appearance in terms of job interviewing. We have grants that pay for dentures, that pay for dental care, and that has been really important also to just building people's self-confidence when they've got new teeth. We do work with our state vocational rehabilitation division and have a contract with them. Additionally, the state Medicaid program has a code that pays for supported employment. So vocational rehab was really important for the starting of the beginning of adoption of supported employment in the state of Oregon. They were a big partner at the table.
Thank you, Rachel. Melissa, did you want to add to that?
No, I think Rachel really helped to sum it up. I know that in communities across the country, lack of dental care is a critical barrier to employment, and so I think the role of state vocational rehabilitation departments is absolutely critical, and I know that other communities have struggled with providing access to these services. So I think Rachel is a great resource.
Great. Thank you, Melissa. And at this point, I'd like to direct participants to a list of resources that we have available for the resources will link you to our permanent supportive housing resources, but also there's a link to the National Transitional Jobs Network, and if anybody would like to request technical assistance, we do have a form that you can complete to request technical assistance for your site, and then also the link to our webinars as well as the archived recording is at the bottom of this screen. And with this, I'll send it over to Julie, who will conclude our webinar session.
All right, thank you for joining Integrating Employment Strategies into Supportive Housing Programs webinar produced by the National Healthcare for the Homeless Council. This webinar will be archived on our website at www.nhchc.org, as Sabrina provided the link on the last slide. That will be posted within 72 hours, and you will also be able to download a PDF copy of the PowerPoint slide presentation. Questions that the presenters, that you would like to send to the presenters, please email staff and we'll be able to forward those on this topic.